from extraction to cognition in one easy move. Okay, so my name is Richard Pither. I'm the CEO of Cytox, and we've spent the last 9 years developing a test to assess future risk of cognitive decline due to Alzheimer's disease, all from a simple saliva sample. So I was last here in 2014, and I want to tell you about a couple of major things that have changed, and some things perhaps that haven't changed so much in the last 8 or 9 years. Perhaps the most important thing is that we're now on the market. So all the R&D risk that we had 8 years ago has been reduced, and now this is a story about commercial delivery and on-the-ground execution. Our test is marketed as genoSCORE. In the US, we have a commercial partner called Infinity Biologics that helped get the test samples collected and analyzed and then reported back to the referring clinician. And in the UK and Europe, we sell this as genoSCORE lab test. And this is a test that's sold directly to physicians, not to the public. This is a big deal. You cannot unknow your risk for Alzheimer's disease. Do you really want to know? And what about the consequences? So there are 2 consequences. You could find that you're in a high-risk group, and you might think, well, that's a really bad thing to know. But actually, what I'm going to explain is that something like 40% of the risk for Alzheimer's disease is modifiable, just through lifestyle and other sort of interventions, which I'll explain later. And the other finding, of course, is you could find that you're in a low-risk group, and that's good news in itself. So 2 groups of patients that are using this test today, and I'll explain those groups in a moment. But this is how the test works. So we've got on the left-hand side at the top, individuals with cognitive concerns. Is this concern due to the early stages of Alzheimer's disease or not? I want to know that so that I can plan accordingly. Or perhaps I'm a younger individual with a family history, a parent or a grandparent who may have suffered, and I want to know whether I've inherited any risk. So people will present to the clinician, they'll undergo some cognitive tests, and at the same time we'll be running the genoSCORE to see whether the genetics and the symptoms are actually aligned or not. And we've published, as you might expect, a lot of data in high-class scientific peer-reviewed journals, and you can see that if you are high risk using our genoSCORE test, your cognitive performance will decline over the following 4 years. And that was proven in this group with early symptoms. On the other hand, even if you have early symptoms, but a low test result, you can see you're relatively cognitively stable using this very large clinical longitudinal study. So incredibly powerful test, and it also works in people without symptoms. So we can predict cognitive decline even from a cognitively normal, healthy starting point. Now, why is this important? Well, 2 reasons really. One is that there are a huge and growing number of people developing Alzheimer's disease, largely because this is a disease of older age, and we're all living longer thanks to medical interventions and healthier living. But the downside is that the longer we live, the higher the risk for Alzheimer's disease. The other big need is the fact that the tests that are out there today are either inaccurate, they are highly invasive, involving lumbar puncture, for example, or injecting radioactive dyes, or they're very expensive. So these PET scans, I spent 15 years of my career with GE Healthcare developing PET imaging agents. These are very expensive, $10,000 per scan per person. So we're looking at something here that can effectively significantly reduce the use of those sorts of high-end and very expensive techniques. Now, we see our major market at this stage in the US, okay, and that's because there is a very well-established private pay market there. There are lots of private clinicians seeing patients on a pay-per-test basis. That sort of market doesn't really exist so much in the UK and Europe, so we're focusing our attention in the US. We launched just around Thanksgiving in November, and here we are, November to March, and you can see some of the traction building. So the number of clinics registered in the blue bars are growing. The numbers of clinics that are requesting kits on a regular basis in the orange bars are growing, and the number of tests ordered in the yellow bars are also growing. And this is with a very minimal sales effort. What I'm here to do today really is to pitch for some funding to help build that sales force. We've got 3 dedicated sales staff starting in 10 days' time. respectively in California, Florida, and Chicago, but we need to expedite and build momentum in that sales effort. This is what the test looks like. It's a box that gets sent to the clinic, or it can be sent to the patient in their own home. Simple saliva test sample is collected, popped in the post, and it goes to a referral lab where DNA is extracted and the assay run and reported back to the clinician. So what are we doing about ramping up sales efforts? So we've got a relationship with a contract sales organization called Vanguard Pharma that we've been working with in the US for the last 9 months, and the work we've done so far has allowed us to generate that early clinical revenues, and we are, through Vanguard, employing 3 full-time salespeople starting on the 28th of March, and these will be trained and operational in early April. We've got a significant customer engagement program directed at the clinics themselves, which is already pulling in new registered clinics, as you saw earlier. And we are starting in April a direct-to-consumer digital marketing campaign. So this is aimed at the would-be users, the patients, and all their family members, to educate them as to what this test can do and drive demand, so pull through those clinics. And so when the inquiries come in from patients, we don't deal with them directly, but we direct them to clinics registered to use our test in their own locality. And of course, we're doing a lot of extensive marketing and PR campaigns associated with all this. We've already got interest from significant premier clinical practices with multiple sites and with potential for hundreds of tests per month. So this is a very significant demand which we are expecting to come through in the next few weeks. We're also working with telemedicine providers. In the US, telemedicine is a really big thing, particularly people living in more rural areas. They want access to clinics and clinicians and specialists without necessarily having to travel too far to achieve that. So there's a telemedicine company that have hundreds of thousands of patients already registered with them who are looking to license this test from us. In parallel, we are actually seeking separate approvals that will ultimately lead to reimbursement. We think the biggest market opportunity for this test is not so much private pay, although that's a very significant opportunity. It's actually a fully reimbursed test, be that through private insurers in the US, and Canada, actually, which is where we're also selling the test, or through national health systems such as the NHS, or indeed private insurers in Europe. And so we're doing that work in parallel with the early commercial rollout. And last but by no means least, we have relationships with major pharma companies who are still recruiting into trials aimed at proving the efficacy of their treatments. And we'll talk a little bit about that in a moment. And if you're interested in some of the clinicians who are using our test, be they in Canada, the US, or the UK, I'd encourage you to go to our website and take a look and listen to some of the early experience of this test. Now, you might be thinking, well, if there's nothing I can do in terms of disease-modifying treatment, would I really want to know my risk? And there are two responses really to that. The first is that there are lots of modifiable risk factors, about 12 of them altogether, that together constitute about 40 to 50% of the risk of Alzheimer's disease. So if you know you're at risk, even if you've got early symptoms, there are things you can do and should be doing to reduce the likelihood or push back the time when those symptoms might become problematic. And these have been published and summarized in a very important report by the Lancet Commission at the end of 2020, which is still too much of a secret. People don't know about this report, and yet it's one of the most important things that's happened in this field in the last 10 years, in my view. And some of them are summarized in this graphic, which I won't go through here now. And some of them, of course, are things that we ought to be doing anyway. You know, eating healthily and taking lots of exercise and not being sort of too socially isolated. But also treating comorbidities such as hypertension, type 2 diabetes, have a very material effect on the risk of developing and the rate of progression of Alzheimer's disease. The other important thing that's happened last year, of course, is that you may have heard controversially, the FDA did approve a drug for treatment called Aduhelm, developed by Biogen. And there are other similar drugs coming through the FDA at the moment. Now, these are not reimbursed at a sensible rate in the US, and they're not even approved in Europe and the UK, but there's going to be a huge amount of momentum when these other major pharma join Biogen in pushing authorities to reimburse these drugs. Whether that happens or not, what it is doing is driving awareness, public awareness of the need to understand and mitigate risk for Alzheimer's disease. And that for us is driving interest in our test. So that dynamic is a very important one, whether or not these drugs are highly efficacious or indeed reimbursed ultimately. Now, in terms of market opportunity, you can value this in many ways, and all of them are probably an underestimate. But if you look at new dementia cases in North America and Europe every year, there are about 2.5 million, 2.6 million new diagnoses every year. If you then look at the mild cognitive impairment, some of these early symptoms that develop, which may or may not be due to Alzheimer's disease, you're up into very significantly higher numbers. And if you, of course, a lot of our customers, our patients, actually are people without symptoms at all. So these numbers, get very big very quickly. But you can easily see an annualized market opportunity of $5 billion. This is a huge and growing market need. And that's just in Europe and North America. So this is the team, and this team have been delivering with me since the company was really first operational in 2013. It's been quite a long road to get to this point, but as I say, now the R&D risk has been reduced, and the risk now is all about operational and rollout at a commercial level. And with that in mind, a former colleague of mine from GE Healthcare, Ian McClellan, came in about 9 months ago to lead commercial operations. And these are our new US sales team, Ed Lewis, Monique Gregory and Phil Grant, who will be hitting the road in April and really trying to push and drive these first sales. And it's a really exciting time. I'm an R&D guy by training, and it takes years for me to have an idea and then find out whether it was successful or not. And unfortunately, this time it has been. With the sales type activities, we're able to monitor this on a monthly, quarterly and annual basis. So it's a very dynamic and exciting time for the company. And we've been lucky to have some very committed investors during that time as well. Some of the major ones listed here, but also a lot of high net worth individuals as well have backed the company from the early days. So we are looking to close a funding round. We had the first close already from existing investors last month. We brought in about 1.24 of new money, and that gives us a runway to the end of the year. We tend to burn about 100,000 a month. And we are looking to a second close in May to get us close to 5 million. 3 million would be okay, 5 million would be great, because it really allows us to invest heavily in these sales activities in the North American market. So we're looking for an extra sort of about £3.5 million, and our pre-money valuation is about 14 million today, 15.6 on a fully diluted basis. So if you're interested, I'd be happy to take questions at the end of this presentation, of course, but we're also on stand number 25 up in the coffee area, so if anyone would like to come and talk to me, please do. And I should finish by saying that we have some very important commercial partnerships. Infinity Biologics are our lab partner in the US, and this is a fully clear LDT accredited test. In Europe, we work with Your Gene Health in Manchester, and this is a CE marked in vitro diagnostic test in the UK and Europe. Vanguard Pharma are our contract sales organization in the US and North America, and Thermo Fisher Scientific are our partners on the platform side, which means that the test and the platform that it runs on are manufactured to the highest clinical standards. So I will finish with that, and happy to take any questions now, or as I said, come to stand 25 if you'd like to talk in more detail. Thank you.
Are there any questions?
Good morning. Just wondered about when when it will be available in the UK, and when you expect regulatory approval? And in fact, can somebody access it now from the UK?
Yes, thank you for the question. So the question, if you didn't hear it, is this available in the UK, or when will it be available? The answer to which is it is available. We've got 2 clinics registered, one in London and one in Buckinghamshire, that could offer you this test tomorrow if they saw fit. So the first thing to do is to contact the clinic. Discussion with the clinician will then determine whether it's appropriate for the individual who's made the inquiry, and then the test will be ordered from us. So it's already available, and as I say, it's a CE marked in vitro diagnostic product. So all the regulatory approvals are in place for offering that. Our commercial efforts are focused largely across the Atlantic because that's where we see the biggest demand right now. We think that the UK and European markets are more likely to take off once we've got full reimbursement in place. That's a longer term process. Thank you.
Yeah, sorry, I missed the beginning. How does the test work? Would you?
Okay, so this is a genetic test. So we take a saliva sample or blood. It's sent to a central lab and DNA is extracted, run on something called a genomic array. And that array is looking for DNA variants, about 112,000 of them, that we all carry, some of which constitute slight increased risk for developing Alzheimer's, others are protective. So we have a polygenic risk algorithm that looks at all those variants, combines them in a weighted score to give you a high, medium or low risk output.
And what does it cost?
Okay, so we don't sell this to individual patients or the public, we sell this to clinicians, and what they charge for the test is really their business. So in some cases, it's a simple pass-through cost. In others, they like to wrap it up into a bigger, collection of services and healthcare products. But we sell this, our selling price in the US, our list price is $765 to the clinic. In fact, that's our asking price. Our actual selling price at the moment is around $612. That's what we're getting per test, essentially.
So about £500.
Roughly £500.
Yes. I did the Chariot study, which I don't know.
Ah, yes, of course, yes. Know it well.
Okay.
We know Lefkos Middleton very well.
I was just patient.
Right. So stand 25 if you're interested in a discussion. Thank you.